Hi, my name is Katherine Glaser. I'm the current micrographic surgery and dermatologic oncology fellow at UC Irvine, and I'll be talking a little bit about my experience during the COVID pandemic. I have no relevant disclosures for this talk, and while I'm sure the idea of yet another COVID talk and reminiscing on 2020 may not seem too thrilling, and some of you may use this as an opportunity to stretch those cozy pajama-covered legs. And while I too hope that 2020 stays in our past, there is much that can be learned from our experiences providing care during the COVID pandemic. Through this pandemic, we have all been forced to embrace change, adapt to an increasingly digitized world of medicine, maintain relationships both personal and work-related with less face-to-face time, and most importantly, we've had to reflect on how we can maintain high-quality patient care with less office visits. And this will be extremely important even after the pandemic is over, as there's many instances where frequent office visits are not possible for our patients, such as those with physical limitations, disabilities, or those who live in distant geographic locations. And while I have not yet figured out a way to do my procedures virtually, I'd like to spend the next few minutes discussing some of the lessons that I've learned from the pandemic and their utility for my surgical and cosmetic patients. Teledermatology has been around well before the COVID pandemic, but its integration into our daily practice has vastly expanded. There's two main types of technology: store and forward, where patients or referring providers will send in still photographs, or live interactive technology, similar to an office visit where there's real-time video conferencing, or a combination of the above. There are few trials that actually compare these modalities, and there really is no cookie-cutter algorithm, so it comes down to your and your patient's preference and comfort level. In our procedural practice, we're often utilizing store and forward technology for our follow-up visits, wound checks, or after photodynamic therapy or topical chemotherapies, whereas we use the live interactive technology for our consultations for cosmetic patients, or for example, our first-time Mohs patients. There's a lot of benefits to teledermatology, including very high rates of patient satisfaction. We know that it can decrease the number of office visits, travel times, and wait times for our patients, and it's generally cost effective. However, it requires a lot of technology on our part and our patient's part, and it relies on high quality images. We are not able to perform as complete of a physical exam, and we cannot perform tests such as cultures or biopsies. The question of medical legal issues also comes up, and if these images are kept private and HIPAA compliant. And while reimbursement is improving for teledermatology, it's not consistent through each insurance and through the states that we work in. COVID has also forced many of us to question the dogma of what suture types and suture techniques should be used where. We know that the use of absorbable sutures can minimize the need for a suture removal follow-up visit, whether it be for punch biopsies, excisions, or repairs. And there's ample literature to suggest that using these absorbable sutures can provide similar aesthetic outcomes and has similar complication rates to those that are non-absorbable. And with less routine follow-up visits, it's extremely important to utilize the time that we do have with the patient during their procedure visit to ensure that they have the education and tools for a smooth post-operative course. We've been spending more time during and after the procedure counseling our patients, and we often include their family members in the wound care discussion, either by phone call or video conferencing. We've been giving wound care printouts ahead of time before the patients come into the exam room, so they can utilize their time while they're in the room to review them and ask questions before they leave the office. We also try to have our patients obtain their wound care supplies or any prophylactic medications that may be needed ahead of time so that we can increase their compliance. We also try to make sure to establish what mode of communication we will be using before they leave the office, whether that's downloading apps on their phone or helping them activate their electronic medical record web portal, which we use to communicate through. And we also try to touch base with our patients shortly after the procedure, either by a quick phone call, text, email, or through the medical record system to make sure that if there's any questions or concerns, we can intervene and clarify sooner. And as we begin relying on photographs in place of these office visits, it's extremely important that the images are of the highest quality. We in our practice take photos of every patient before their procedure and after the procedure while they're at their appointment with us, so we can help establish a baseline. This also helps us monitor for complications or progression down the road. And since many of us don't have the luxury of hiring a medical photographer, we're relying on the use of smartphones and tablets in our own hands or those of our support staff. Consistency and training of our support staff is key to obtain high quality photos. And while they're taking these photos, it's important to educate the patients on how we want them to take photographs after they leave the office. Now, of course, we want different photos depending on the situation. For our cosmetic patients, we're taking a series of photographs head-on, 45-degree angles, 90-degree angles, both still and with facial expression. For post-op, we're having them do zoomed out and zoomed in. And for these, we've often been giving them preset instructions so they know exactly what we want from them. And we've even considered adding example photographs so that they know what we're looking for. We've all had the letdown of receiving those photographs instead of an office visit and not knowing what to do with them. You can see in the center, the gentleman has lots of distractors in the background, and he's holding the camera far too close to his face, causing a lot of facial distortion. And on the right, you see a lot of blurring and poor lighting and exposure of the photographs. To take a high quality photograph, you want to make sure there's a plain background or use a cloth sheet. We want bright natural lighting. We want to remove all the distractions such as jewelry or their glasses. And setting up the camera is important. We don't want filters or any special settings. And the orientation of the body part should be either horizontal or vertical and fill the frame of the photograph. Hold the camera a little bit further away and zoom in rather than close up so we can avoid that distortion. Here's an example of what a difference it can make when you add a plain backdrop, proper lighting, and reorienting the camera so that the foot fills the frame and is now vertical. I hope these tips will help you provide high quality care to your patients, especially those undergoing procedures who are not able to come for frequent office visits. I hope you guys stay safe, healthy, and I hope we get to see everybody in Hawaii next year. Thank you.